I'm not the house of cards that falls down easily. I'm strong enough to handle what you throw at me.
Welcome to Mental Health News Radio. I'm your host, Kristin Walker. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all we promised, we'd be cordial.
Hi everyone, Kristin Walker here. We are doing a show on our mental health business series. We have Ann Noto with us, who is the Vice President of Information and Technology, Human Resources and Administrative Services at the New Jersey Association of Mental Health and Addiction Agencies, NJAMHAA. That's a mouthful. I can't believe I said that without messing up even once. Hi, June.
Hi, Kristin. Thanks for having me today.
Absolutely. So tell our listeners a little bit about the background that you have that makes you able to do a job like this.
So I started my career back in my late 20s. I was a computer programmer, COBOL programmer, actually. And I've had the fortune to have one career lead me to the next. And it's been very gratifying to be female in technology for over 40 years. And I've had a very diverse background, from publishing to list management and mail merge dedupes for the post office to encouraging our providers to start looking at data to make decisions. I had 7 years working in a mental health facility, fairly large one here in New Jersey. And for the last 20 years, I've been at the association directing this contract that we have at the state called the IT project. And we have been advisory services and a liaison between mental health providers and their technology vendors for over 20 years, since 1986, actually. We've had this contract. So it's been really fulfilling.
How is this different than some of the HSEs that are out there?
So there are organizations, like my trade association is an advocacy organization where we try to reduce stigma. We lobby for access to services. We are the only trade association in the state that has this type of project that is funded by the state. Actually, I think we're the only ones in the nation that have a project like this. And it's very valued because back in the 80s, when providers were asking for dollars in their contracts for technology, people at the state didn't know what that was.
Right.
Why do you need Lotus? Why do you need Lotus? And they would say, well, you ask us to submit our budgets, and every time there's a change, they have to erase and rewrite or retype these long type of spreadsheets to submit a budget. So they said, we'll use Lotus. It's a spreadsheet package. No one knew what it was, but the equipment that it required was about $6,000 to run on a little compact, portable, luggable, for the lack of a better word. They were not very portable. They looked like very big pieces of luggage. And the state did not know what to do with this. So they put together this consortium of my trade association, some external vendors, and it turned into this thing called the Community Information Technology Project. And I've been overseeing it now for about 20 years.
Wow. And do you work with other states that have the same type of association as this?
Well, we have collaborative workings with some of our, we call them sister organizations, but typically this really is just New Jersey State. I
Okay.
have been involved in different work groups at the national level. I've worked with CMS and SAMHSA, part of the Decision Support 2000 project that they had, which no one ever used at the federal level. But it's mostly just a state driven enterprise.
Okay. So here's a question for you, with, my background being in tech also, and yay for those of us females that were getting into tech and in high positions back when we really weren't very welcome.
Correct. Exactly. I know. And I've got the stories too.
So, oh boy, do I have some stories.
Hmm.
Server closets that you go, okay, there's only one exit. How the hell am I going to get out of here? Yeah. But, when I first got into the behavioral health, like solely focused on the behavioral health side of things in terms of EHR technology. I was in technology way, 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 way long before, and had clients that were in behavioral health. I mean, Ross Perot's company, Pro Systems Healthcare, was a client for years, and then I was there for the transition for when Dell purchased that company. So I've been in it. But when I stepped into behavioral health, it was right when meaningful use was the hot thing.
Hmm.
And I saw the marketing initiatives that went out around that and how the vendors utilized that for good and not so good in order to obviously get people to, buy their EHRs. And that's, kind of waned. It's not the big hot thing anymore. And I've heard a lot of vendors say, well, we need the next, we need another one of those things in order to, give us the impetus to push our software again. And things have changed. People are on their third, fourth, fifth EHR now. They're not like when I started, we were getting people off of paper. So they're a lot wiser in their choices. They don't need as much consultants like me to help them because they've been through the wars now with technology. But what I'm wondering is, in this long winding question, do you see the coronavirus and all of this that's happening in this big, huge no longer a trickle in of telehealth? This is mandatory. Are you seeing that as kind of the next sort of meaningful use type thing that, spearheads a marketing agenda?
I do think so. Well, telehealth has its obstacles with privacy and security. I actually just spoke with an executive director this morning that was wondering how much advocacy was being done for the future for telehealth in mental health outpatient, because she has seen an increase in participation from Medicaid clients. And whereas normally she would not see these, she lives in a very, her organization's in a very rural area of New Jersey. And it's giving people the opportunity to actually speak with somebody without having to get in their car and drive an hour or 45 minutes somewhere. And
Right.
so today the conversation that we had was, she's actually got demonstrated proof that telehealth is actually bringing in more clients.
Right.
And so that's, and she asked what could she do to spearhead the advocacy with our organization. And I was very encouraged. And I don't do a lot on the advocacy side of our house. I really am on the technology and compliance side. But, we work very cooperatively together. We're a small organization overall. And so this is really good. Our members are very active and they really want to implement change or see change happen. So they're willing to get behind the driver's seat and help us move in that direction. So I see this as a positive thing moving forward. I also mentioned that, on the privacy side, getting the consumers to understand that the people that they might be in session with, if it's a group session, they have to understand that, there are privacy considerations. You can't,
Yes.
really have your son and daughter in the room with you while you're, in your group session or something.
Right.
But New Jersey, and I'm sure it's the same for many states, we've relaxed a lot of the requirements and regulations in order to get the help to people who need it.
How, I know obviously you work with EHR technology and many other types of technology that want to know your organization, want to be recommended by your organization because of the reach that you have. How does your organization keep itself unbiased?
So we vet anyone that really wants to do business with us, and we make sure that, they're a reputable organization. We have many different programs. A lot of trade associations do. So we have an approved vendor program. We have a technology council. Our technology council has about, I think it's 12 EHR vendors that are on it. It is open to anyone really that wants to join, but I vet them. I take demonstrations of their platforms. And we send out references to make sure that they have a good reputation in the industry. And I very rarely, if ever, have ever come across an organization where someone said don't do business with them,
Right.
or it's a conflict, or they have they have bad customer service. It does not cost a lot of money to join my association, and it's wonderful in getting the word out to a population that you may not have inroads to.
Right. Yeah, exactly. With what's going on right now, how are you guys, handling, the working office situation?
So during when we had Hurricane Sandy, the East Coast was very impacted tremendously, and my particular office was closed for 7 days. So, and here at home, we didn't have electric for several days. There was no internet access. I would have to go to my car to charge phones and devices. So that put our business continuity plan in place at NJAMHAA. And as a result, we already had a lot of the pieces that we needed to work remotely. We are an Office 365 we're users. We have remote VPNs, terminal server, all of those pieces were in place. So for the operations of my particular organization, it was pretty flawless. We just had to make sure that my staff was able to, we're using a product called Doulton, so that if you did have a desktop, we would give them a laptop to take home, and then they could use their computer in the office as if they were sitting there. So we were in pretty good shape. But part of the IT project, we have about 30 organizations that we support in terms of their IT, their infrastructure. We are either their IT staff, or we supplement their IT staff. And many of our customers they hit the ground and they're like, what do we do? So we have been working remotely. My entire team has been working remotely since mid-March, and bringing all of our customers up to make sure that they are secure, to make sure that they have the tools that are in place. We actually had a shipment of 10 computers because the direct support professionals, the residential businesses, they're hiring because there are people that are not staying on the job. So while there's a lot of unemployment going on, there's actually still a lot of employment opportunities available in particular fields.
Oh,
So
that's good to know.
yeah, so they're getting computers, and we're configuring them remotely. So these are things that we would normally go to the agency's facility. We would put them on the network, and we would install all that. We're doing all of this remotely now, something we've never done before, and it's working. And so we saw a lot in the beginning. In the first several weeks, how do I get online? My remote connection's not working. The VPN's giving me an error. And now we have seen a lot of that tailor off, where we're not getting that many calls like we used to. We man a help desk. That's part of the contract that we have with the state, to be able to answer questions for providers that are out there. And we also manage some of the state, do tech support for some of the state portals that they have out there that track mental health data.
What I love about this, and you and I, had a previous conversation about it, and I'd love to get into more here too, is, the anybody that has been a holdout in terms of technology, any organization that's just fought tooth and nail. I'm not going to get on an electronic health record, or I'm not going to do telehealth. Now it's a matter of, well, you do it. It's not an elective anymore. You either do it or you don't work.
Yeah, it's the same with even electronic health records. So not even so much telehealth. Like, we still have a large population of providers that don't have electronic records. They are in the substance use field. Many of the providers in substance use were not eligible for meaningful use incentive dollars. They didn't have the eligible providers. But the state of New Jersey now has this new program in place called Promoting Interoperability Project, specifically for substance use providers, to enable them to get a little bit of financial assistance to implement an electronic record so that they can then share data. One of the The concept behind it being is that someone has an overdose, they wind up in an emergency room, and then they don't get their clinical treatment or care with their provider because the provider doesn't even know that they've had an overdose. And it's not until they voluntarily show up at the next program or next outpatient or whatever it is, the treatment they're receiving. If the hospital were able to send an alert to the providing clinician, then at least they would know they had to reach out. Oh, my patient's in the hospital, and I need to reach out to them and intervene at that point, rather than waiting for the patient or the client to get out of the emergency room and then either go back into the field and use again, or will they seek help, is up to them. At least this way it gives the providers an opportunity to do that outreach and to intervene before they go back into the community.
Absolutely. And it's technology that's, making that happen.
Right.
So how do you see, and you've been in and around this, how have you seen the way that IT has looked at change? Now, where I'm coming from, and you already know this, is, back when I was getting started and so on, this is like the Palm Pilot. I had one of the first AOL email addresses. I mean, I'm right in that age group, and IT was this enigma that controlled companies, but also was treated so poorly by the general population, just treated horribly. I've seen that change. I did have a bit of a double take when I got into the mental health field, because it seemed like it was like 10 years behind every other field. So
Right.
Some of that treatment still towards anyone in an IT profession was still there, which was surprising, being that it's mental health. But I am starting to notice that just isn't there at all, or as much. But you're at a much higher place than I am in terms of that view. So what are your thoughts?
So I believe that users drive change, and when you use technology, it can drive change for everyone else. So the providers, we were trying to encourage many of our providers to look at data. And they would say, well, I don't have data anywhere to look at. I mean, I have files, I have clinical charts. I don't know what you're talking about. They could look at their financial data because they all had general ledgers, and they could do that. But when it came time to make clinical decisions, they didn't have the data readily available at their fingertips. We had run a project many years ago. We were the first in New Jersey to run a benchmarking project. And we did it both nationwide for national data, and then we did a statewide comparative data and tool. And while it was a wonderful concept, we couldn't get a lot of buy-in because it was a lot of work for a lot of the providers because they couldn't compile the data. So while we knew they needed to look at data, and technology is the way you're going to get to that data, it was sort of a buy-in because they realized, hey, they're right. We need to look at data to make decisions. We can't operate in a vacuum anymore. Well, what is it that we need to be able to get to that data? They need technology to get to that data. They need the infrastructure to be able to track it, compile it, look at it, review it, and then make business decisions. And so that helped. The very first, we had a large New Jersey consortium for EHR adoption just prior to meaningful use. And I think there were 5 or 6 mental health providers that all got together. They were fairly large. They went through a vetting process and they picked a particular product. And that is wound up getting like 40% share of market in the state of New Jersey. And that kind of was the beginning of adoption. As soon as meaningful use hit, it just exploded here in our state. So I find that the providers who need to make those decisions are doing very well with their technology. We're not getting as much pushback as you had mentioned in the beginning, where, technology and us, we would sit in the back room somewhere and people would just say, oh, I can't believe we have to do this.
Or they'd say, you walked by my office and now my printer doesn't work. Get in here and fix it. You're like, okay, it doesn't work like that.
But Kristin, what I find to be the biggest obstacle are state systems. State systems are very, very far behind the times. And you can even see in the pandemic that we have now, everybody's talking about utilizing data and utilizing data. Well, where are they getting the data from?
Right.
Data from the states. And if the states don't have a way to collect that data effectively, they're not going to get valuable information. So in the mental health system specifically, they are trying, but I have been advocating for well over 20 years for, let's say, we have a system here called, it's called a unified services transaction. And it is a mechanism for the states to get their block grant funding from the federal government. So their counts are how many people were admitted, how many were discharged, how many have gone from one program to the other. For over 20 years, I have been advocating for the state to drop a Microsoft Access program that was written in the year 1999, which we are still using and supporting today, to try and come up with a better mechanism. And then their systems on the back end, they don't talk to each other.
Right.
And so all of this disparate data and silos of information, that exists on the state side. And it's a barrier and an obstacle to the providers who have to interface with them.
Absolutely. I mean, I hear it, and I'm shocked, but I hear it, from different EHR vendors that I work with. Well, no one can connect to the state of whatever for their state reporting. We have to use their system and manually key in the information, and any EHR that can actually do that. And it's not that they don't have the skill to connect. Some of it is the technology is so old on the state side that new technology can't even talk to it.
Correct.
And the other part of it is the state side isn't really motivated to be helpful. So sometimes it's, well, look, we've been calling, we've done everything on our side, and we just hear nothing. And then to get them to tweak something that they need to tweak is like a 6-week process. So it's not that it can't be done. It's just there's that wall.
Correct. And then resources become tight. So for example, I think it just was on the news yesterday, should states be allowed to declare bankruptcy? Well, we know that at least in our state, we have to have a balanced budget. I don't think that's an option. So they've taken steps already where they've already published where they're going to cut for the rest of the fiscal year. They've taken $1.25 million out of all IT initiatives. So, here, and I don't know what they were earmarked for. I'm not at that level, but I'm thinking IT initiatives, we need IT now more than ever. So they're cutting,
exactly.
You know what I'm saying? So it's kind of like, I get where you're coming from. You need to save money. You've got to balance the budget, but you're pulling over $1 million out of IT initiatives that maybe could be earmarked to work on this particular project. Or, but I see it all the time. And we've been very fortunate at my company. I mean, we've gone through several budget cuts over the 20 years, or at least that I've been there. And we've managed to be able to stay solvent. And I think we're working now with half the money we used to many years ago. But we're also generating revenues because we perform services in the field the same way a provider would perform services. The customers I mentioned before, we are their IT staff. They pay us for that service like they would any service provider. So, we've built that little piece of business to help keep the association strong as well, provide a valuable service to the community. And the state loves us for it because we're doing something that nobody else in the country is doing.
Absolutely. Absolutely. I mean, that's why I was asking you in the beginning, are other states, are you working with other states that have initiatives like yours? Because oftentimes, there's a project that a state will put together, a consortium like yours, and then other states find out about it and go, hey, we need to be doing that too. And then they end up working together, not to, be funders or to help with the setup, just, we want to emulate what you're doing because it's working so well. Can you give us, a template as to how you did it? So that's why I was asking that question. I hope other states, have come to you to say, how can this be done successfully? And you guys had a resource to go to and say, how can this be done successfully?
Correct. And I will say we've had the advantage of having state buy-in many years ago. And so in the comment that I just made about the state, my particular state, cutting IT initiatives, for another state to come into a project like this, they would need some sort of financial backing.
Right.
You just can't do it. You can't just, launch it off. You need some sort of influx of money. And if it were not for the state, I'm not sure we could run the IT project. We bring in revenues, but not enough to support the infrastructure. We work, I charge my highest rate to send someone in the field is $91 an hour. to come to your facility to work on your computer to install or fix whatever is broken.
Right.
And you can't find an IT vendor out there that would work for $91 an hour.
Exactly. I mean,
And I can go down as low as $70 an hour, because if we have a structure where you purchase a block of hours. The more hours you purchase, the more generous I can be. That's revenue in a big block that comes into my organization. We are used to operating not on a monthly income, but on a sort of a contract basis. So you want to give me $40,000 to provide services to your organization? I'll take it.
right.
And I will give you the best possible rate going forward. And that's how we have it structured. The more hours somebody purchases, the less the rate per hour. And so we've been able to do that. But if we didn't have funding from the state, I'm not really sure we would be viable.
Right, exactly. Let's talk about in our last few minutes. You guys have a lot of conferences that you're doing. I was looking at it in your email that you sent to me with your bio. How do those work for you guys, and about how many people, come to those venues, and how is that changing for you now that we're don't have more than 10 people, or, not even that anymore?
Correct. So we scrambled, like many associations or organizations that do conferences. Our conferences were originally scheduled for the beginning and middle of April. So the first thing we did was contact the venue. We sought to get a new date. So now our dates are out in October. And since there is still a degree of uncertainty as to whether we would do an in-person event or not, we're looking for ways to present virtually.
Right.
So I work with a training partner. I have a grant with the Department of Labor whereby we offer free training to providers so they can get CEUs, and they're all clinical topics. And I'm now working with that training provider to now offer this out to everyone, because people can't go in person to get training. So we're putting together a 10-course series with CEUs attached in clinical topics. Like dialectal behavioral therapy. I might have correctly.
Dialectical, yeah, you got it.
Right. Or mindfulness. The courses that tend to do very well in our Department of Labor grant. So we're going to start offering those now to the community. So we're rethinking. We're trying to just come up with new ways. We take direction. We saw national councils going virtual. The national. And I think it's NJPRN, Preventative Resource Network. They're going virtual. Open Minds is virtual. So we are just following the leader. I'm currently doing that, looking for the best platforms, who's comfortable with which platform.
Right.
I had someone that did an Adobe Connect platform and said it was very nice. I had never even heard of it before. So, there are a lot of options that are available, and I have from now till October to figure that out.
To figure it exactly amongst all of the other things that you have on your plate.
Yes.
Yeah, exactly. Well, very last question is, how was this kind of a field attractive for you, and how was it for you? Did you have some kind of personal reason as to why it veered into the behavioral health side?
Yes, I did. So I was in the for-profit world for many years. I worked for companies like McGraw-Hill, Royal Doulton, and not to disparage the commercial, and for-profit industry, but I'm also a mental health consumer. And so having received therapy during college and, all of the traumas of growing up,
Right.
And things, I experienced mental health counseling very early in college life. And I took to that. I really liked the idea that these resources were available because no one was talking to anybody back then.
Absolutely.
Right. So when I had an opportunity was presented to me, happened to be job searching. And a gentleman reached out to me from a behavioral health organization, and he was going to pay me less money for a shorter commute. I was commuting 2 hours to my job at the time. And he said, I'm not going to be able to pay you what you're currently making, but I said, no problem. Let's have the talk. And I worked with that company, that behavioral health organization for 7 years.
Mm-hmm.
And then I had this opportunity at the New Jersey Association of Mental Health and Addiction Agencies. And I moved there, and I've been there, and that's been my home for the last 20 years.
That's amazing. And I will say this, those of us females that have been in tech as long as we have needed counseling.
Yes. I hear you. It wasn't even just that. It was, but yeah, I had a lot of the male pushback. I had some a lot of the harassment as well.
Yep.
I remember before leaving one of my jobs saying something to my boss about the experience that I had at that organization in terms of harassment, and his reply to me was, well, that'll just make sure that I never hire another woman. And I thought, wow, like here I am thinking I'm doing you guys a favor. I'm telling you something about something. And that was his response. Well, that company's no longer in business.
Yeah. Yep. I know. Oh boy. I have my own stories I've shared on my show many, many times, and one with an EHR vendor that was awful. And you can bet they never got recommended by me ever again.
Right.
Didn't matter whether the software was good or not. It wasn't. It was the person that created it can't keep his hands to himself. So yeah. And that's a whole other conversation. June, thank you so much for, first of all, doing what you do, and also coming on the show. Please tell our listeners where they can find out more about you and your organization.
Sure. So my website is www.njamhaa.org. It's New Jersey Association of Mental Health and Addiction Agencies. And we have there's a sidebar for the IT project if you want to learn more about what we do and who we serve. And I'd be happy to have a discussion with anybody, internationally or nationally. And there's my puppy chiming in right now.
Because we're all working from home. Exactly. Well, thank you for coming on. And listeners, thank you for tuning in to Mental Health Business, our series on Mental Health News Radio. Hi, listeners. I'll make it quick. These are some really cool places that give discounts and other cool things for listeners of Mental Health News Radio Network. If you want to get amazing help with healing from narcissistic abuse, go to healfromanarcissist.com. If you want CBD products that are the best of the best, I use them myself, go to proze.com and use the code mentalhealth20, mentalhealth20. If you want to get daily perk ups that help retrain your brain to think more positively, go to perkupdaily.com. And also, just because this one's fun, snarkycandles.com. I guarantee you'll love them. Snarky with a Y, SNARKY, candles.com. And don't forget, if you want to hear all the shows on the network about first responders, you can go to firstrespondermentalhealthnetwork.com, and all of our shows that focus on narcissistic abuse, narcissistabusehealingnetwork.com. Thanks for listening, and back to the show.
Sometimes I'm passive aggressive, but never without good intentions. I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps, or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song, Cordial, for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you. After all, we promised we'd be cordial. Sometimes in you I can fight it, but I oppose it.
Good boy.